Welcome to the channel. Today, we're diving into a fascinating and often startling topic. For older viewers who remember their rise to fame, these transformations may come as a shock and a sobering reminder that even fame can protect us from the pressures of aging in the public eye. Which of these changes surprised you the most? Stay with us. You might not believe who's next on the list. They once graced red carpets, magazine covers, and TV screens with unforgettable faces. But today, many of these celebrities are nearly unrecognizable. In a world obsessed with youth and perfection, some stars took cosmetic procedures too far, chasing beauty at a cost few imagined. Julia Tarasevich, once celebrated as a Russian beauty queen, endured a deeply painful chapter in her life after a cosmetic surgery went terribly wrong. Seeking a touch-up to maintain her youthful glow, she underwent a facelift, eyelid surgery, and minor liposuction at a private clinic in Russia. But instead of enhancing her features, the procedure left her with severe swelling, visible scarring, and a heartbreaking inability to even close her eyes. At 43, Julia found herself struggling not just with her appearance, but with basic daily comfort, an outcome no patient ever expects. The surgeries, rather than refining her look, robbed her of physical ease and emotional peace. Determined to hold someone accountable, she filed a lawsuit against the two surgeons involved. She alleged gross medical negligence. In their defense, the doctors blamed an undiagnosed case of scleroderma, a rare autoimmune disease that hardens the skin, but Julia firmly denied ever having such a condition prior to surgery. Despite spending a fortune trying to reverse the damage, she openly admitted that her face might never return to how it once was. Lin May, born Lilia Guadalupe Moyame, was a captivating figure in Mexico's golden era of entertainment. In the 1970s, she rose to fame as a dancer and actress, adored across Latin America for her stage presence and natural beauty. But as time passed and the pressures of maintaining youth in the spotlight mounted, Lin made a decision that would change her life forever. Driven by societal expectations and her own fear of aging, Lin turned to cosmetic surgery not out of vanity, but in hopes of correcting a congenital facial asymmetry that had long troubled her. Unfortunately, in seeking perfection, she fell victim to a dangerous scam. A supposed practitioner lacking proper medical training injected baby oil into her cheeks, a substance never meant for human tissue. The aftermath was devastating. Infections, disfigurement, and emotional pain followed. Lin's once iconic features became distorted, and repeated attempts to correct the damage only made things worse. Over the years, tabloids circulated shocking images that chronicled her transformation, often without compassion. Her face, once celebrated, now bore the tragic results of misplaced trust and unregulated procedures. Now in her 70s, Lin has spoken publicly about her ordeal, bravely using her platform to warn others. Her story is not just about beauty lost, it's about dignity, vulnerability, and the high price of chasing youth in an image-obsessed world. If there's one takeaway, it's this. Do your research, ask questions, and never let fear rush you into a decision that may be irreversible. Have you or someone you know faced pressure to look younger? What would you do differently if given the chance? Let us know. Your story might be what someone else needs to hear today. Michela Romanina's story serves as a haunting reflection of beauty's fleeting nature, especially under the harsh lights of fame. Once a celebrated Italian socialite, Michela captivated attention not just for her glamorous lifestyle, but later for a transformation that shocked even the most jaded observers. Driven by the desire to stay youthful, Michela, like many public figures, turned to cosmetic enhancements. Her preferred method, collagen injections, especially to her lips. At first, the changes were subtle, but over time, what began as maintenance became obsession. Procedure followed procedure. The pursuit of perfection blurred into compulsion. Photographs from the early 1990s show a vibrant woman with elegant features. Fast forward a decade, and the change is unmistakable. Her lips became dramatically her facial contours altered to the point where even close acquaintances struggled to recognize her. The media, often unforgiving, used her image as a cautionary tale, sometimes cruelly, but not without merit. Unlike a temporary makeover or a well-placed lift, excessive cosmetic alterations carry lasting consequences physically and emotionally. Michela's story isn't just about appearance, it's about identity, self-worth, and the societal pressures that drive some to extremes. She rarely speaks publicly now, but her image remains a powerful symbol. Her journey reminds us that beauty, when pursued without restraint, can lead to unintended and irreversible outcomes. Before seeking change, ask yourself, is this for me or for the mirror held up by others? Have you ever felt pressured to look younger or witnessed someone go too far? Share your thoughts. Your experience could be the voice of reason someone needs today. Carol Bryan once sought what many consider a modest, common procedure, dermal fillers to refresh her appearance. At 47, she simply wanted to smooth a few lines, hoping to age gracefully. but that simple decision would change her life in ways she could never have foreseen. In 2009, during what she believed to be a routine cosmetic enhancement, Carol was injected with a dangerous mix of dermal fillers, including silicone, a substance not approved for facial use. The fillers were placed in her forehead and cheeks. First, there were no alarming signs, but weeks later, her face began to swell, distort, and harden. Instead of youthful refinement, Carol was left with disfigurement so severe that even her closest friends could barely recognize her. She tried desperately to reverse the damage, seeking help from numerous doctors, but the condition worsened. The physical pain was matched only by the emotional toll. She isolated herself from the world, allowing only her daughter to see her. At her lowest point, Carol contemplated taking her own life. In 2013, she turned to a craniofacial surgeon, hopeful for a second chance. But the surgery, while partially reconstructive, came at a devastating cost. It permanently damaged her optic nerve, leaving her blind in one eye. Over time, she would undergo additional skin grafts and facial surgeries to rebuild what was lost. Now in her late 50s, Carol speaks publicly about her journey. Though she continues to battle insecurity and no longer seeks romantic relationships, her story has become a beacon for others, an urgent reminder that cosmetic procedures, while often marketed as harmless, can have lifelong consequences. Before you say yes to that injection or procedure, ask yourself, have you asked enough questions? Have you checked the credentials? Have you or a loved one ever felt unsure about a cosmetic treatment? Your experience could help someone else avoid a similar fate. Share your story. It matters. Tara Jane McConaughey, a 33-year-old from Melbourne, Australia, is a headline fixture for her radical transformation in the name of beauty. With over 200,000 AUD invested, Tara turns heads everywhere. Dubbed the real-life Barbie, her journey includes 5 breast augmentations, 6 nose surgeries, and countless Botox and filler sessions, reshaping her face into a hyper-stylized version of femininity. Her appearance draws both fascination and criticism, leading to features on shows like Botched. Tara sees beauty as an evolving canvas and has no plans to stop, even considering increasing her bust size beyond safe proportions despite doctor warnings. Her story prompts a crucial question: is this pursuit of perfection truly freeing us, or merely transforming us into someone we no longer recognize? Pete Burns, the flamboyant lead singer of 80s band Dead or Alive, was as known for his dramatic transformation as his hit song You Spin Me Round. What started as a routine nose job after an injury escalated into a relentless pursuit of Burns underwent nearly 300 procedures, from lip fillers to full facial reconstructions. Despite serious complications, infections, and mounting pain, he continued, seeing himself as his own creation. He spent a fortune chasing an aesthetic no doctor could guarantee. Pete's life ended in 2016 at 57, but his story sparked crucial conversations about body image, identity, and the surprising cost of physical reinvention. His legacy isn't just headlines, it's the booming voice from a time when being different was celebrated. Dennis Avner, famously known as Stalking Cat, lived a life truly unconventional. This Navy veteran and computer programmer embarked on a radical physical transformation inspired by a shaman's suggestion to align with his tiger spiritual totem. Avner changed his name and then his appearance, moving into extreme body modification. Working with pioneers, he underwent over 14 surgical procedures, including subdermal implants for feline contours, a split upper lip, reshaped ears, nasal flattening, and even a motorized tail. His pursuit was spiritual, not for spectacle, yet spectacle followed. He appeared on major TV shows and earned a Guinness World Record. Despite his otherworldly look, Dennis lived a quiet life, seeking alignment between his inner self and outward appearance. His haunting journey reminds us of conviction, daring the world to look twice. Jocelyn Wildenstein, famously dubbed the Lion Woman of New York, represents one of the most extreme cosmetic transformations. Once an elegant Swiss socialite, her journey began in the 1990s, reportedly to save her marriage. What started subtly quickly escalated into extensive procedures, multiple facelifts, brow lifts, collagen injections, and implants, all aimed at achieving a more feline appearance. The results were startling. Her once soft features became hardened and exaggerated, making her an international symbol of plastic surgery gone wrong. Despite public scrutiny, Wildenstein remains unapologetic, claiming happiness with her look. Her story raises complex questions about body image and the immense pressure to manipulate beauty standards, serving as a potent reminder of the irreversible consequences in pursuit of an ideal. Linda Evangelist, an iconic 90s supermodel known for her transformative beauty, largely vanished from the public eye. In 2021, she revealed the heartbreaking reason. A cosmetic procedure called cool sculpting cryolipolysis had left her brutally disfigured. This non-invasive fat reduction treatment paradoxically caused a rare side effect: paradoxical adipose Hyperplasia PA, where fat cells grew and hardened into bulges. This severe reaction left her unrecognizable and plunged her into deep depression. Evangelista has since undergone corrective surgeries with limited success and filed a lawsuit. Her courageous disclosure shed light on the lesser-known risks of cosmetic procedures, even seemingly safe ones, serving as a stark reminder that beauty's pursuit carries unforeseen risks. Mickey Rourke, the charismatic 80s leading man known for his edgy good looks, saw his face dramatically altered by plastic surgery. After a boxing career in the 90s, Rourke sustained significant facial injuries, including broken bones, leading him to seek reconstructive surgery. He later stated the initial procedures were botched, prompting a series of further operations, including multiple nose jobs, facelifts, and dental work to repair the damage. However, the cumulative effect profoundly changed his distinctive features, rendering him nearly unrecognizable to many fans. Rourke's journey is a compelling case of necessary reconstruction spiraling into a pursuit that reshaped his public image. His candidness serves as a cautionary tale about the complexities and unpredictable outcomes of facial surgery. Thank you for watching. Don't forget to like, share, and subscribe to the channel so you don't miss any new videos. See you in the next one.